everyone, and welcome to another episode of MedSynapse podcast series. Today, we are diving into a topic that every woman should know about but is often clouded by myths and misinformation, which is breast cancer. Breast cancer is one of the most common cancers worldwide, and yet, myths around it often prevent women from seeking timely care or understanding their risks. And to help us separate fact from fiction, Dr. Ritika Bhandari. Dr. Ritika is passionate about advocacy and patient education, ensuring women have the knowledge and tools they need to prioritize early detection and informed decision making. Doctor is a breast oncoplastic surgeon with an impeccable record, with an MBBS and MS in general surgery and advanced training in breast oncology and reconstructive surgery. She is a leading expert in breast health. Her experience, along with her commitment to patient advocacy, makes her the perfect voice for this conversation. So, thank you, doctor, for being here. And so, doctor, before we start talking about cancer, could you just share a bit about your professional journey and what led you to expertise in breast oncology, especially?
So thank you for such a warm welcome. Thank you for the opportunity also. If like to begin with, when I did my MBBS, MS, I was in a government set of a hospital, and most of the patients what we used to treat is by doing the mastectomies, means complete removal of the breast. And I've seen the patient with low morale, and they can't afford a normal reconstructive surgery also. What we used to think is maybe they were not affordable, means the patient is not able to afford the oncoplasty surgery. Because in our society, Indian society, it is more like a male person or the male family member decide what surgery the female is going to undergo. So that is something which is very disheartening. Then when patient used to come for follow-up, they used to ask, what is there any alternative? So then I came to know, like, yes, there is some fellowship and some advanced techniques that we can use, and it is not just complete removal. We can do the oncoplasty surgery. What I mean by oncoplasty is we are removing only the tumor which is involved in the breast, and we remove with the margins. So we are removing only a part of the breast tissue with the safe margins, and to fill that gap, we are using the local tissue. It's not a big plastic surgery or something. It is just a mobilization of the fat or muscles which are nearby, but it will give a cosmesis which is near normal breast for the patient. So with like minute detailing and with some like small changes and small effort, we can improve the cosmesis, because for that patient she's going to undergo surgery for the first or hopefully for the last time. So but to do these things, it will make a lot of difference. In being a female, I know what is the importance of body imaging and all these things. So from that I got like an idea, like I want to pursue this only. So being a general surgeon, but now my focus is only on the breast and mainly on the oncoplasty surgery. So in my practice, out of 100, maybe 80 per, like, it's not like all patient can undergo breast conservation. There are various other technicalities to it, but whoever is in which I can give breast conservation surgery. So out of 100, if there are 100 patients, so 85 patients do undergo breast conservation surgery also. And
Yes.
I can see the smile on their face. So it's like nothing has happened to them. So that to me is something which is driving in this field. And afterwards, another 1 year of fellowship from Max Healthcare, and hopefully some more fellowship are on the way. So currently I'm practicing in Mumbai and Thane. Yeah, that's from my side.
Yes, that's actually so overwhelming to hear your entire journey and especially about the breast reconstruction. So now let's just start bursting some myths and also knowing some facts about breast cancer. So, doctor, despite the availability of accurate information, myths about breast cancer remain so widespread. So, why do you think this is the case?
So it's yeah, you are right. Actually, there is so much of information on Google, but still, I come to see a lot of patients who are very much aware about their health. Like
Right.
uh, very well educated also, but still they're having a myth. So first thing is misinformation, basically, which spread by the word of mouth, and it spread more faster than a correct or accurate information, that I believe. So if you have heard of a controversy which happened a few weeks back, in which the former cricketer, he was telling taking turmeric and eating this diet will cure breast cancer, despite the fact that
Mhm.
they have taken whole of the treatment. So if we keep on telling no, 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 this is not true, but the word of mouth and the misinformation, it spread and it make more impact on the people. I don't know why. So that is the reason. Second thing is breast, like cancer diagnosis is a very emotional aspect actually. So patient wants to hear what is more comforting to them, and they don't want to deep dive into some complex facts or information. So for them, that is more soothing and that is more applicable, and that is their hearing around their surrounding. So I used to hear like, doctor, does black bra, wearing a bra or black bra will cause breast cancer? So that is very commonly encountered. So something which is external, how can they cause a cancer? So there are various myths. I think we will be dealing with it in our conversation also. So yeah, that's what, because word of mouth is there, social
Mhm.
media is there, and people are listening to anything. So that is the reason, which is that's why the myths are prevailing so much.
Yes, that is very true. I think
Yeah.
social media actually plays a major role into this dynamic as well, especially spreading some kind of misinformation also. And I think, as you
Yes.
also mentioned, misinformation actually spreads so much faster than facts.
Yes. True. Yeah.
So now, doctor, in your experience, what's the most significant barrier healthcare professionals face when trying to dispel myths about breast cancer?
So, yeah. So, first of all, when the patient came to us, any patient, they have a deeply ingrained belief and some fear regarding the disease. So, to counter those fear with our facts, so the for the patient, it is so much deeply ingrained in them, they're not ready to accept what you are telling. So for that, we need to build a communication. We have to explain them everything very clearly with the facts and the figures. Like we have so much of studies which are there. So with that, I used to tackle them with the fact, like whatever they're saying with the like some or the other study which is there. So I usually tackle them. But yes, they have some belief which are there, which are so strong and so embedded that they don't want to shatter them at any cost. And the second thing, they also don't want to discuss the complex datas, or they're not interested in all those things. So they're happy with their own belief. So to ingrain them, I make sure if any patient come to me, so I'll ask them, what do you think, what are the causes, kaise
Mhm.
hua? Because in community, somebody or the other in the relative, close family, or in the neighborhood must have breast cancer. It is so prevalent. In India, it is 1 in 28 women having the risk of breast cancer. So I usually deal with the myths in my consultations also.
Right. I think that's really interesting to know your techniques also. But one more question is like, what strategies do you think that healthcare professionals should always look out for, especially when they are busting such myths also? Because patients would usually come with some or the other questions to you. So, what would your strategy be?
So I usually ask them first what they think, and then I give them a factual figure. So they can't deter to that. They have to believe that, because that is something which is scientific. And when a healthcare professional is taking each and every doubt and telling you clear explanation about everything, so that makes sense to them also. So eventually, by the end of the conversation, they are more and more convinced. I usually keep a letterhead or pamphlet kind of a thing also, and I usually give it to the patient so that they just read and they should come to know. And they are also very amazed to hear, because there is nobody who is there to correct them. But yes, people are very open also to the facts. If you tell you, like if you'll tell and explain something which is very clear and factual, so they will believe. So that logic is there, so they will believe. So I make sure like 5 6, like a biopsy can lead to breast cancer or it can spread cancer. wearing like any color of bra can cause breast cancer, eating sugar, all these are myths. So these are most commonly like 4 5 things I usually ask them, and
Hmm.
mostly they only ask them,
Yeah,
doctor हमने ऐसा सुना है, is it like that? So if we give you clear explanation, then yeah, they
it's true.
kind of agree to it at the end. Yeah.
So one more common myth is that breast cancer is always hereditary. So can you explain how genetics actually contribute to breast cancer risk?
So yeah, that is a very scary thing for the patient, because patient only thinks like, if somebody in my family is getting cancer, breast
Hmm.
cancer, so now boom, I'm going to get it. So, but you will be very amazed to know, and as per the data also, only 10, like 5 to 10% of the breast cancer cases are hereditary. It means rest 80 to 85%, kya reason hai? It's all sporadic. We don't know. There can be some lifestyle changes, our food habits, our like eating pattern, or can be some age factor. Then various risk factors like modifiable, not modifiable, patient who is not breastfeeding, any radiation exposure, early started of period, late ending of the periods. So these are all the risk factors, modifiable age, and being a female itself is a risk factor for breast cancer. So so only the what I mean to say is the genetic part is only 5 to 10%. So they should not be scared about that, because they can't do anything if something is coming. What they can do and deal, they should tackle with, and is the 85%, 80 to 85%.
Hmm.
That is somewhat some like things which are modifiable, like doing the marriage at an early age, not early as means before 30, getting your first childbirth before 30. These are something which is modifiable.
Hmm.
Obesity, lifestyle habits, alcohol. So they should not be stressful about thinking of that 5 to 10%. They should work on the other 85%.
Right.
So yeah.
I think that is really interesting because I think if you take care of your health and especially lifestyle, a lot of changes can be prevented later on as
Yes.
well. So now,
Yeah,
Dr.
right, right.
Biopsies are often feared by patients due to myths about spreading cancer. So, how do you
Yeah.
address these concerns with your patients?
Yeah, so it's a very like out of I think 10 patients, 9 will have the this fear. Like, so ma'am हमने सुना है कि इससे फैल जाएगा. So what I used to say is that it is a very critical diagnostic tool which help us to guide how to proceed with the management in our like breast cancer setting. It's not only the diagnosis which is important,
Mhm.
it is the biology of the tumor that is also very important. To be specific, ER, PR, and HER2 status. That we got to know from the biopsy only. So for us, the biopsy is the critical diagnostic tool to start to start the treatment also. So that is like it is must for us. So first of all, I tell them the importance of getting the biopsy done. And second thing, I tell them the whole step, like in very clear manner, step by step, like how I'm going to proceed with this procedure, and how what I'm going to do, how we are going to take that sample and everything. So if like there is a clear communication between you and the patient, and you are telling them each and everything with clear explanation, then it make a trust. And obviously this is a myth, so that is also a myth buster also. So with clear explanation, yeah, they then come to the
Hmm.
point, and then yes, it is a very important diagnostic and critical tool. So they also understand. So basically, step-by-step approach is very important in this procedure.
Correct. I think a simple explanation and step-by-step explanation helps them also to understand and actually elevate, like
Yes,
it so elevates so much of fear also, like it decreases the
stress.
fear and it elevates the understanding also, yes. So
Right,
now
right.
compliance with follow-up care and treatment is also another critical area for breast cancer. So, what are the best practices that healthcare professionals can adopt to improve patient compliance?
So yeah, first of all is we have to tell them what is the importance of follow-up. So for first 2 year after all the treatment times, ask them to come for every 3 monthly visits. So patient ko lagta hai, no, it is not that important. They're just telling to make money or like that. So what I have a paper with me in my OPD in which all the guidelines are there. So as per the NCCN, more or less patient agrees to that, but if like there is some issue with the traveling or the distance or expenses, so then we make it to customizable to the patient also. Like if it is 3 monthly, we tell them okay 4 or 5, something like that. So first thing is support and trust. You have to build that trust with the patient. You have to explain like I'm a surgeon, so each and every detail about the surgery, what all line of treatment, because it is not about the surgery or the chemotherapy. It's a mixture of all the treatment, chemo,
Mm.
radiation, surgery, and hormonal treatment also, which also patient has to take for 5 to 10 years, like an oral tablet also. So if you have a trust, like with the patient, trust building is important, and clear communication,
Yes.
explaining why is it important, so what this tablet will do, why you need to come, why the clinical breast examination is important. So once the patient is diagnosed with the breast cancer, they usually come for the follow up. So they know the importance because they're already diagnosed with the case. So if I tell them to come and if they're totally fine after all the treatment, so they trust me. Like she was there with me
Mm.
for day one, and chemo is also a very long process. So they become like a family member to us. I'm very approachable also, as in I give my own number to them, and so that they can call me. If something
Mm.
is there, if they can't come, at least they can send the basic workup to me. And one more thing is support group. That is also very important.
Mm.
So this I learned from my teacher, my guru, Dr. Geeta Kadaprat ma'am. So she used to create a support group among patients. So whoever is treated or is getting treated. So there is a WhatsApp group, and we used to add all the survivors and everyone in that. And the patient who just got diagnosed with the breast cancer, they they were also given the like they also enter the group. And then the patient was already being treated and it has on undergone chemotherapy, everything, they were the one who are counseling them and telling them no, see, nothing is happening to us also, we are like living a normal life now. So you
Mm.
can also be that person, just be more like, they also feel motivated, because if I'm telling them, yeah, if I'm telling them you should be like, your family should support
Mm.
you, nothing will happen, this will pass away. But if the patient herself or himself is telling, so that make a lot of difference. And that
True.
support group create a connectivity also. We have like monthly or 3 monthly meetings also, some functions, some talks. So that is also very important for trust building. So yeah, these
Yes.
are the things that I use. Yeah.
I actually really like the fact that you just told that you make a WhatsApp group, you make a community that, and then with the help of those community, it actually impacts also a patient who's actually
Yes.
surviving. So it does make a huge difference, I suppose.
Right.
Um, Now, doctor, are there any cases or case studies from your practice where addressing a myth actually led to a timely intervention and better outcomes?
So yeah, so this one patient, she came to me. She has a scary mammogram, like a speculated lesion was there, and she was very feared of the fact that the biopsy can lead to spreading of the disease, as we have already discussed. So for that patient, I like clearly tell what are the procedure, how we are going to proceed, and when we did the biopsy, she came out to an early breast cancer, and we did a breast conservation surgery for her, radiation, and now she's absolutely fine. So early detection is also very important. So this patient, yeah, so her survival rate, everything will be much better than a person who came to us at a later stage. So yeah,
Yeah.
I remember this case very, yeah.
It actually helped how for early detection as well, and her entire journey as well, where it could have been
Right.
earlier, it had earlier been detected and
Detection.
treatment was
Yes.
taken care of. Yes, so it actually highlights
Yes.
the impact of accurate information also. Now,
Yes.
finally,
Yes.
doctor, if you could share one fact about breast cancer that you think everyone should prioritize in their discussions, so what would that be?
So what I want all the healthcare professionals, whether medical, radiation, or a surgical oncologist, they should deal like the main motto. What should be there is early detection save lives. So I have given the example also. So early detection, if I'll tell you stage wise, stage 1, 2, 3, 4, the survival rate in stage 1 it is 100%. Means every person who is stage 1 detected with a breast cancer has 100% survival rate. So nothing like that, right?
Hmm.
So if early detection means by screening, so as you have like now there are a lot of film stars who are getting the cancer and it is coming more and more on the social media and more of the awareness. But regular screening is always mandatory. So every female who is before 40 should get an ultrasound done once a year, sorry, and mammogram after the age of 40. Mammogram is compulsory. After it will also covered in many of the insurance companies also. So once a year mammogram, and I make sure I tell each and every patient how to do a self breast examination.
Hmm.
So that is also very important. That should be done once a month by the patient herself. There is no tools or nothing extra which is needed, only just the patient and her own hand, and she should know the technique, and that's it. So early detection can save. I have given multiple examples also to the patient. So now when they are aware and they know what to see, when to address, like when to go to see a doctor. So these all signs and symptoms are also very important. So early screening, mammogram, self-breast examination. So these are what like we as a healthcare professional needs to tell our patients. So for me, that is very important.
I think that's a great takeaway actually for healthcare professionals. And also, I think it is a reminder that awareness actually truly saves a lot of lives, also. And spreading the right kind of awareness is also, again, very important because with the rise of social media, the misinformation has also increased these days, I feel.
Yes.
So, Doctor, as we wrap up today's session, thank you so much for joining us today and sharing your expertise on such an important and crucial topics. So, thank you so much, Doctor.
Yeah, thank you so much from your whole team also for your time and making this meeting happen. Thank you so much.
Thank you. And I'm sure our listeners will also leave this session feeling more informed and empowered than before. So, thank you so much,
Yeah.
Doctor, again. And to our listeners, thank you for tuning into this episode. And remember, knowledge is your best defense against myths and misinformation. And also, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So, until next time, stay informed, stay proactive, and as always, stay healthy.